Hey guys, welcome to Proactive Prudence. This is a channel for allied health sciences, and in this video, we'll be studying about anatomy and the terms of location, position, and planes that are used while referring to anatomical positions. So, why do we need to study the terms of location, position, and planes? It is important because whenever you describe a part from a human body, you'll have to know which position it is in. So when you have to tell what the position is, you'll have to know the name of the position. Well, so it is very important to study the anatomical position. So what is anatomical position? It is a standard form of positioning of the body when it is standing upright, facing forward, with each arms hanging on either side of the body and the palms facing forward. The legs should be parallel with feet flat on the floor and facing forward. So how does the anatomical position look like? So you can see the picture which I have represented in locations. You can see that ventral or anterior position with you can see that the person is positioned in such a way that he's standing upright, he's facing forward with arms hanging on either side. You can see those arms being on either side and palms facing towards you, with feet with the legs parallel to each other, and the feet should be flat on the floor. You can see that that is the ventral or the anterior position. Then there's one more position which is dorsal or the posterior for location of the human body. You can see the medial and the lateral position. Medial is towards the chest and lateral is towards the shoulders. So the position of it is shown in the picture. Moving on, we'll see what is proximal, cranial, or superior, which is the same but using different terms, and distal, caudal, inferior, which are the same, which are referred to the same thing. So proximal is towards your body and distal is away from your body. I hope you understood. Proximal is towards your body and distal is away from your body. So you can see the skeletal picture as well as the positioning of proximal and distal, which is represented with the arrows. Moving on, there are superficial and deep. I've shown the picture of a palm. So the upper layer or the skin, which you can see, is the superficial, and deep is the inner bones and muscles that you can see in the picture. Moving on, ipsilateral and contralateral. So I've put a picture of unilateral, which is one sided, bilateral, two sides. Ipsilateral is same side of the body, and contralateral is opposite side of the body. Please do look into the picture and read the positioning of or the location of the human body. It is very important to study it in this way so that you can understand it better. Moving on, we have invagination and evagination. So, what is invagination? Invagination is towards inside, and I've shown the picture of invagination wherein the basal surface and the apical surface move inside, and evagination is moving outside. Moving on, we'll see what is medial border and lateral border. Medial border is the middle border, the midline, and lateral border is the lateral sides or the sideway borders. You can see that in the picture also. Moving on to the next location, ankle position. You can see that flexor is moving forwards and extensor is extension of the muscle. That is, extension is moving away. Now we have seen the location, and now we'll be moving on to the body movements that is observed in human body. I've put a picture of a gliding movement. The gliding movement, now I want you to face your palm in front of you and move it sideways. So when you move it sideways as shown in the picture, it is called as gliding movement, as well as back and forth, that is front and back. So that is called a gliding movement. Moving on, I have put one more position location, I mean body movement of the body movement of a human. So you can see there's angular movement. Angular is moving in different angles. Gliding is just to and fro, but angular is towards whichever angle, like 90 degree, 45 degree. You're moving your leg, so moving your leg or hand. So there are different angular movements like adduction, abduction, extension, lateral flexion, and flexion. So what is adduction? Adduction is moving your leg or foot towards your body. That is called adduction. Moving away is abduction. Note, Adduction is moving towards your body, abduction is moving away from your body with an angle. Then comes the extension and lateral flexion and flexion. So extension is, in the previous video I've shown you the flexion, that is moving your leg forwards, and extension is moving your leg backwards. Lateral flexion is moving your leg to the side in a flexion form, that is called as lateral flexion. Moving on to the next body movement, which is rotation. There are two types of rotation, that are medial rotation and lateral rotation. I've put the picture of it. So when you move your feet towards your middle border or the medial side, that is called as medial rotation. And if you move your feet to the lateral rotation, it is called as lateral rotation. Moving on to the various other special movements that are observed, that is pronation, supination, protraction, and retraction. So pronation is moving your palm towards your side, and supination is moving your palm away. So you can see that in the picture. So that is semi pronation, pronation, and supination. So we have seen the special movements also. We'll just move on to the next body movement, which is circumduction. Circumduction is moving your arm in circular form, that is called as circumduction. So opposition of thumb. So when you see your fingers, your thumb can oppositely touch each and every finger. It can touch the forefinger, the middle finger, the ring finger, and the little finger. So that is called opposition of thumb. Circumduction of thumb is you can rotate your thumb. That is called as circumduction of thumb. Dorsiflexion of foot. I'll show that in the next image. So you can see there are different movement of foot that is being represented in the image. So dorsiflexion, plantar flexion. Dorsiflexion is again shown with the uh, muscular and the bone structures. Plantar flexion also. Then eversion, inversion of foot. Opening of mouth, you know what is opening of mouth and closure of mouth is, so they are also included in body movements. Moving on to the position, which is very important when you come into AHS, that is Allied Health Science, because position, knowing the position is very much important. When your doctor tells to position the person into anatomical position, so that is represented in the first image, which is anatomical position. Supine position is lying flat on the bed, so that is called as supine position. You can see that in the image. Prone position is making the patient to sleep on his front, so you can see that in the image also. You have to place the pillow below his head, as well as below his stomach and below his leg. Moving on to lithotomy. Lithotomy position is where two legs are attached far from each other. These are used while doing a cystoscopy. Please let me know what is a cystoscopy in the comment section. We'll see whether it's correct or not. So moving on, we have Trendelenburg position, so which is also an important position. You'll have to know it. And lateral position, making the patient to sleep sideways, is called as lateral position, by placing the pillow in front of his chest as well as below one leg. Moving on to the Fowler's position, you can observe that the uh, position of the patient is in such a way that it has 30 to 45 degrees. Okay. Then we have left lateral. So the position of the patient is in left lateral form. Then right lateral, the same right lateral recumbent. Then you have Sims position. It is a aerial a top view of the patient, how he is being made to lie on the bed. So that is Sims position. Orthopenic or tripod position. Reverse Trendelenburg position. So these are the different positions of human body. So here completes the topic for terms of location, position, and planes. I hope you understood. If you couldn't understand, please do go back to the video, play it again, see what are the different positions and locations and the planes that is being observed in anatomy, which is very very important for study of anatomy. In future videos we'll be uploading, it'll have the positions where you'll have to know which position where exactly you're referring to. So here completes the video. I hope you like the video. Please do subscribe and share the video to know the different subjects that I'll be uploading in the channel.